Hello, everyone. Welcome. Before we get started today, we wanted to ask you a set of polling questions. So we're going to go ahead and launch this first one. You should see that on your screen. Please select the option that suits you best. We'll give it another 10 seconds. Our apologies. Sorry, presenters, if you could mute yourselves. Next polling question coming here. And seeing about 90% of folks on the line today are from urban areas. Go ahead and ask the next question. Recognizing that this webinar was sent across Canada just to see if you're in BC or another province. Another 5 seconds. One last question here. Five more seconds. The percent of you said that the recovery services in BC are somewhat accessible. So we're going to go ahead and close that. Okay. I'm going to go ahead and share my screen. All right, so we're going to get started now. So welcome, everyone. This is part 2 of our recovery series. So if you joined us last week, part 1 was all about maintaining and initiating recovery. And today we're here to talk about awareness and celebration. So before we get started today, I also want to take a moment to reflect on the land in which we're gathering and listening into this webinar. So on behalf of my colleagues in the Lower Mainland, we want to respectfully acknowledge the land on which we're working is the traditional territory of the Coast Salish peoples, including the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. But given that this is a national webinar, this would be a good time to reflect on the lands in which you're listening and calling in from today, and giving thanks to the land in which we're residing. So as I mentioned today, this is part of a 4-part webinar series talking all things recovery, but particularly strengthening recovery during crises. So today we're talking about awareness and celebration. So what you can expect from us today is a bit of a panel discussion. We've got some amazing panelists that we're going to introduce momentarily. We also will have time to answer your questions. So now's a good time to mention that in your chat function in this GoToWebinar platform, you'll be able to type your questions. We're going to go ahead and take about 4 to 5 of those questions later on in this webinar. So please go ahead and let us know if you have any questions at this point or throughout this whole webinar. So I'm just going to introduce our guests. As I mentioned, we have an amazing panel set for you today. So first up is Dr. Evan Wood, who's the Executive Director of the BC Centre on Substance Use. He's an addiction physician and researcher as well at our centre, and is a Canadian Research Chair in Addiction Medicine and holds a professorship in medicine at the University of British Columbia. Next, we have Lorinda Strang, who's the Executive Director of the Orchard Recovery Centre. And Lorinda is one of the founding members who helped kickstart the first Recovery Day in Vancouver. She sits on the board of the BC Addiction Recovery Association, Recovery Day Society, and the Family Stakeholder Committee with the BCCSU. We have Jordan Veller joining us, who's the Operations Supervisor at Westminster House Society. Jordan relocated to New West from Vancouver Island to begin her journey to recovery. On May 26th, she will be abstinent from all mood and mind-altering substances, including methadone, for 4 years. Her career is focused on residential addiction recovery and is a supervisor at Westminster House Society, a nonprofit addiction recovery program for youth and adult women. We have Sergeant Jeff Scott joining us from the city of New West. So Sergeant Scott has been with the New West Police Department for 15 years. He served the city in the Patrol Division, Marine Unit, Collision Reconstruction Team, and the Operational Support Unit. He went on to become a patrol supervisor and now is the sergeant in charge of media relations and human resources. We also have Jessica Cooksey joining us, the operations manager of Last Door Recovery Centre. And Jessica is a member of the BC Addiction Recovery Association, the Provincial Opiate Addiction Treatment Support Program Committee, and Fraser Health Authority Substance Use Network. Last but certainly not least, we have Carson McPherson joining us, who's the Executive Director of Cedars at Cobble Hill. He is also a resident, the Cobble Hill is a residential addiction treatment facility on Vancouver Island and is a member of the BC Addiction Recovery Association. He also sits on the National Policy Committee for the Canadian Society of Addiction Medicine. And so my name's Amanda Giesler, and I'll be one of your co-moderators today. But we also have Giuseppe Ganci, who's the Director of Community Development with Lost Door Recovery Centre, as your other moderator. He is at the Last Door Recovery Society, which is one of the largest sober events. He's a committee chairperson for the Clean and Sober and Proud, one of the largest sober events during Pride Day in the world, chairman of the board of the Recovery Day Society. He also co-hosts and produces a weekly live radio show called Talk Recovery Radio on 100.5 FM. So with that, we're going to move into our question and discussion period of this webinar, and Giuseppe is going to walk us through that. Over to you, Giuseppe. Oh, you might be muted. Sorry.
Sorry about that. Thank you, Amanda, for the introductions and the acknowledgement, and thank you to everyone that's participating in this webinar. This is part 2, and appreciate you taking time out of your day. And thank you to all the panelists that are joining us here for a conversation about recovery. Definitely one thing that I want to start off with, our idea collectively, the idea of recovery. What is it, recovery from addiction? And it's the simplest definition that I found is recovery is an indefinite progressive journey towards improved health function and happiness. And it includes many, many pathways and many different models. And here we have a great panel to help us out with some questions on how we can strengthen recovery. And I'm really pleased that Dr. Evan Wood is here. Hello, Evan.
Hey, Giuseppe, how are you?
Okay, great. Too, I had a heart attack there for a second. Okay.
Yeah,
hello.
no, I'm here, but the camera is not working, so I'm really sorry about that. I can see all your friendly faces, but unfortunately, you'll just hear my voice, I think.
Okay. Well, Evan, we're got a lot of voices that want to speak, and so I want to try and get quickly with you on what does the scientific literature tell us about recovery? What is the science of recovery?
Yeah, that's one of the things that I think there's a real discordance between societal views and just the scientific reality. And I often share with people the example of people who use tobacco, and that if you walk down the street and talk to people, you'd find a lot of people that were very severely addicted to tobacco and were able to quit. And actually, the fact of the the scientific reality when it comes to people with other forms of severe addiction, the natural history of the disease, and that of course there's a relapsing and remitting course. And for some people, they can of course die of severe addiction. But the sort of pessimistic view that society often has towards people with addiction, the reality, to answer your question, is that the vast majority of people will go into long-term abstinent remission, or what we call recovery. And that's something that I think there's a huge amount of public education and education of policymakers that's required in this space.
Yeah, definitely the conversation about evidence-based, it's kind of become this term, hashtag if you wish, and trying to get all the evidence out there and inform people of all the evidence can be challenging at times. In regards to the network of substance use services here in BC, and also a bit of a national voice, because we have some people that are from outside of BC, how does the network of substance use services support recovery? Are they supporting recovery? Do we need improvement, challenges?
Well, there's so many challenges with the network of services for people struggling with addiction, and I think for many of us, we're aware that when the overdose emergency was declared, it kind of pulled back the curtain to realize how piecemeal the system is. So I would say, first of all, a huge thank you to all the people that work in this sector, oftentimes under-resourced, really working in a difficult environment where this has really been a neglected public health challenge, a neglected disease, if you want to call it that, but certainly a neglected area of wellness in our society. And so I would say, across the board, there are areas for improvement. And if I can sharpen a point on that a little bit, I think it's the connections across the different services and support so as to create a better continuum. So I think all of us are very supportive of, life-saving interventions that can help people not contract an infectious disease like hepatitis C, and clean needles to avoid that, overdose prevention sites and how critical that can be to prevent a fatal overdose. But a continuum ideally would be offering people care across the continuum. And that includes on the other end of the continuum where you have services that are strictly geared towards people pursuing abstinence and being able to support people in the context of a relapse, or if that's a mismatch for them. So I think we've made great strides in terms of services and supports, but with an acknowledgement to the tremendous amount of incredible hard work that's done by people in this sector, much more work to do.
Yeah, definitely. I mean, when you talk about a continuum, you and I have had some chats about the continuum as well. There's stages in those continuum, and the continuum of care is from the consumption sites to an abstinence-based program to a CBT program. There's many different pathways. How does recovery play a role in that community, and how can recovery be seen as just not like one pathway? How does that work?
Well, I think that there's been excellent strides made to including people with lived and living experience in the existing system that we have. But in many instances, it's people that are very experienced with harm reduction. They're very passionate about people supporting people where they're at, and again, I think that's critically important. I think to look at some of the US models and other models with recovery coaches and others that are in recovery, that have walked that path and been able to get out of a life and be able to connect with others that may be interested in that same journey. And I think that there are gaps in the system there. So I think that's how I'd probably answer that question.
Okay. You were at the recovery, I've heard you say this at press conferences, at the Recovery Capital Conference. It's not that the system's broken, but we don't have a system. And that was a few years ago. And so now we're in 2020, and we have COVID, we have homelessness, we have poverty, you know, what are some of the improvements we've made over the years since I remember you saying that a few years ago?
Well, I think there have been certainly some incremental gains, and so just again to acknowledge the work of so many people in the system that have helped contribute to that. I think the training of healthcare practitioners, we've made strides. I think we don't still train doctors and nurses and other practitioners in the same way that we do for other things, and that manifests as healthcare providers not knowing about addiction and how to diagnose it, but also being dangerous with their prescribing with potentially addictive medication. So we've made strides there, but I think there's further room for improvement. I think in the past there were really no guidelines for the treatment of addictive disorders, and we have better guidelines for certain approaches to addiction. I think there's still much more work to be done there, but I think we have made major ground in terms of the sort of guidelines, healthcare practitioner training, and I think a greater recognition, and to some extent, though there's much more work to be done around addressing stigma. It wasn't that long ago in that sort of timeline that you're describing, Giuseppe, where I think people with addiction really didn't talk about their histories now, where whenever I'm talking to patients who are early in their recovery journey, I always like to say, look, it used to be that when people, didn't drink anymore or had made a change in their life, they kind of didn't really talk about it, where I see now people really wearing it like a badge of honor, and they'll be quick to say, no, actually, I haven't had a drink in 5 years.
Mm-hmm.
And people are kind of, wow, hey, that's great. And I think so we've made ground on these things like stigma and some of the other health system interventions, greater acknowledgement that recovery is possible and need to have more emphasis there, things like Recovery Day. So it's hard when you're in a process of trying to create a system, as we all are, to when we feel a sense of urgency, we want to get farther. But I think on a number of fronts, great success and much more to do.
Thank you, Evan. That's Dr. Evan Wood from the BCCSU. And that's what we're talking about, the science of awareness, the science of celebration, the science of recovery. And, many years ago, thanks to Facebook, you would never post your clean date or your recovery date or your history with drug and alcohol use on Facebook. I remember those days, and now it's become the norm. And a lot of that has to do with recovering out loud. And I remember many years ago, Lorinda had an idea, and that idea was Recovery Day in Canada. Lorinda, welcome to this talk about awareness and celebration. Lorinda, how did Recovery Day start? You're one of the founders of Recovery Day. Thank you for that. And what happened and how did it start? You're muted, Lorinda, or we can't hear you. One of the two.
There you go.
There we go.
So it started as a great idea, like most things do, and there was a group of people, and we reached out to be inclusive right from the start, and to bring in you yourself, Giuseppe, and the New West community, the Drug Prevention Network, colleague of mine, Anne-Marie, and from there we formed a group of people. But our goals that we wanted to accomplish were, we wanted to find a way to mobilize the recovery community to speak with one voice. We wanted to reduce the stigma for people in recovery and those who are looking for help. We wanted to create community and showcase the value and importance of supporting people in recovery. We wanted to stand up, and we wanted to be seen, and we wanted to break down the myths and misconceptions. We wanted to show the community at large and those of us in recovery that we make significant contributions to our communities. We wanted to show that recovery is real, it's possible, and it's sustainable. We wanted to find a way to demonstrate the power and proof of recovery from addiction to our policymakers. And we wanted to have a seat at the table whenever there was a decision being made about recovery and how to help people.
Did you find that you didn't have a voice and that you didn't have a seat, and that's changed with Recovery Day?
yeah, I feel we absolutely did not have a seat at the table at the time. And I feel like we do now. We are there. We've made great progress. And as Evan was saying, there's always more work to be done.
As a person in recovery, you know, I always refer to Pride Day as, Recovery Day, like the Pride Day. Many people say, well, what's the point of having Pride Day? Why have Pride Day? You know, what's the point? And I remember in the beginning, you and I, you know, a lot of people didn't even want to participate in Recovery Day. They're like, why bother? Why do it? But then when you show up, you realize why it's important. As a person in recovery, how has Recovery Day and the idea of celebrating recovery out loud affected you personally?
It's made me way more comfortable to go out and speak about being in recovery. And every time that you do share your story, or you're talking wherever you are in any social setting, somebody's listening, somebody needs help, and someone's going to circle back to you at another time and say, hey, I noticed this or that, or I heard your story, or heard you talking, and that spreads. Recovery is contagious, I've heard people say, and that's important. And so it's made that much easier for me personally. I mean, I work in the field, so it's easier for me, but there's a lot of people that work in professional situations that don't feel comfortable about speaking out about recovery. So we wanted to break that down. We want
story.
Empowering, yes.
Story. So
it strengthened the recovery, the service providers. It's helped us all unite and get stronger together.
I remember we couldn't even get 20 service providers together at the very first Recovery Day, and now we had 150. So that didn't exist 10 years ago. What's the next steps for Recovery Day? Recovery Day is localized here. What's our next steps?
Well, I want to reiterate that Recovery Day provides hope, and it builds community, and it builds connections, and we celebrate together. We also grieve together, and you know, all our families and friends, and we get together, and we're stronger, more resilient when we stand together. And so all the Recovery Days, there are Recovery Days happening across Canada, and we want to unite and become stronger together. And I think that the success and the energy of Recovery Day in BC, we can help other communities across the country replicate what we've got going.
That's one of our goals. Yes. Mm-hmm. And so the next steps then, so the Recovery Day, I mean, we got COVID going on right now. What are we seeing for September coming up?
So a huge change in plans. I mean, you look back at the pictures of last year's Recovery Day. For me, the energy that you feel in those on the streets, it's so empowering and so uplifting. And so, you know, I turn it over to you on that respect, Giuseppe. You've always got great ideas, and so it's taking the concept that we had and taking it online.
Yeah, we're hopefully going to do a Recovery Month this year. Yeah. Why is Recovery Month important?
That's what we just spoke about.
Yeah.
We want to bring it to the country, and we want to share that energy.
Excellent. So hopefully Recovery Month will take place in September, and we're looking forward to inviting everybody there. And it's quite an interesting day. If you haven't been to Recovery Day, sadly Recovery Day will not take place as a street festival this year. And we're working with all the different cities across Canada, from here to Halifax, and how we can have Recovery Day still take place virtually. Thanks, Lorinda. Next, we've got Jordan Veller. Jordan Veller. Yes, Jordan's here. We want to make sure that we have a personal story talking about their journey each month at each of these webinars. Hi, Jordan. Oh, sorry, before we go to Jordan, I wanted to talk to Sergeant Jeff Scott, since we just finished talking about recovery. So you got a couple minutes to reflect there, Jordan. Welcome, Sergeant Jeff Scott. How are you?
I'm good. Thanks for having me.
Excellent. Yeah, sorry, on my program, I got you on the wrong side. So Sergeant Scott, you're from New West. We wanted to bring you on. New West has a large recovery community. And how has, and you've been to the Recovery Day events, you've been part of our Recovery Day movement here. How has Recovery Day affected the city of New Westminster?
I think in a lot of real positive ways. So my experience kind of over the last recent years, I've overseen the police operations at Street, the Food Truck Festival and Pride, and Recovery Day Fest and a few other events, all very, very good events. Where it really stands out to me and to the police and to the community is the positivity of Recovery Day Festival. Celebrating people's recovery, celebrating the community now coming around one another. And I think one of the big factors of it is the walls of stigma, I guess we could call it. The walls of stigma are almost coming down because people are having the conversation and celebrating, yes, I'm in recovery. Yes, I haven't had a drink in X amount of months, weeks, years, whatever it is. And that's a cause for celebration. And it helps, I think, people continue forward in that. But I think it also helps the community understand that any sort of barriers that might be in their minds can come down. Oftentimes, historically, people have seen it as, oh, this is a law and order issue, and it's really not. It's we'll get called, police will get called to certain things, but I think there's so many other resources before it becomes to a policing law enforcement aspect. And I think Recovery Day specifically has demonstrated that the gaps between policing and the community and people in recovery, they need to go. And we're all just one community. It's not multiple communities. We're in this together. It's kind of the cliche line right now of COVID-19, right? We're in this together. But I think that term can be explored into other areas as well, where it's, we're one community, wherever we're at in our own journeys, we're in this together, right? And so that for me has been really telling from Recovery Day Festival. It's too bad, like from a personal perspective, it's too bad we're not going to be able to do it, physically together. I think there's some cool ideas that certainly could come from the virtual side of things to still have that sense of community. So I kind of see the terms where it's like, oh, we need to do social distancing. Let's rebrand that. Let's not call it social distancing. Let's call it physical distancing, but socially connected, and keep those connections happening.
In the city of New West, as a police officer, there's research done in various cities and various countries, especially in the UK, where they've done research on the impact of a recovery community to the city. There really hasn't been much of that research done in Canada. There's no funding for it, sadly, like there is in some other countries. But knowing that there's a recovery community that's localized in the city, that's pretty vibrant, as a police officer, does that help when it comes to dealing with individuals with addiction and mental health issues and so forth?
Oh, 100%, 100%. I can't imagine, truthfully, and I've worked in the city of New West for 15 years, and I'm specific to New West in my policing experience, but I can't imagine working in places around the country that don't have accessibility to services, to communities for recovery. I mean, I don't know if it's a sad truth, but it's a realistic truth, is that it becomes, people who need recovery access get it through the police, and it's we want to come alongside and be part of the community, but there's so many barriers between people and the police, and that's just a reality that we're trying to deal with, and we're trying to tear those barriers down. But my experience has been overwhelmingly positive with the recovery community. I know as a police department, it's been overwhelmingly positive. I'm sure it's not perfect. I'm on this side of the law enforcement continuum, if you will, and so I've got my perspective, and But I hope coming into this, and I hope having a recovery community, is that my perspective can change so that I can recognize what's my role in this and what's everybody's role in it. So again, we just highlight that fact. We're in this together, we're a community, and we all want, you know, a positive community. And so we all have our different roles to play in that. So again, I personally, I couldn't imagine being in a community without it. I just, yeah, there's no way.
Thank you, Sergeant Scott. And to all of our attendees, if you have any comments or questions, please feel free. We won't be able to get to all the questions and comments, but we'll be creating a report with all the questions and comments for some follow-up meetings and conversations. And how do we strengthen recovery and break down barriers from police to the community? It's a very good conversation, and more needs to be discussed. Thank you very much. Jordan, now that you had a moment to join us there, Jordan, your journey, I know about your journey, and our goal is to talk about making recovery known, celebrating recovery, making people aware of recovery. And if you can tell us how did you enter your journey to recovery? What happened to you?
Okay, so I mean, so I was homeless, I was addicted to narcotics, and I became pregnant. So that was when I had kind of contemplated that maybe I might need some help getting off the substances that I was using. I was using heroin, crystal meth, quite regularly, and my GP had suggested to me that I should get on methadone, and that would be, like, there was never even really a discussion around it. It was like stopping using substances wasn't an option because I was too far along in my pregnancy that if I was going to keep the baby, it was going to cause harm to him. So the choice was to get on the decision was to get on methadone or just continue to keep using. So I got on methadone, which I saw a different doctor for that. He specialized in just methadone and Suboxone prescriptions at the time. And basically what she said to me was that he needed to get on methadone and needed to stay on methadone. We upped my dose pretty quickly. I got on when I was 6 months pregnant, and I was up to about 150 mils by the time I was probably 8 months pregnant. And yeah, she just said to me point blank, like, because I tried to talk to her about what it was going to look like after I had my son, for coming off of the methadone, because I knew that wasn't something that I wanted to do long term. And she just said to me, if you want to have any chance at having any quality of life with your child, then you need to stay on methadone for, she said 20 years, at least 20 years. Yeah, if you want to have any chance at having any quality of life. And I mean, that was really confusing for me to hear, but I like trying to, like, it's like she's the professional and I'm the addict, so it's like I was just trying to take her advice, I guess, at the time.
And did she give you any options, treatment? Did she talk about recovery in any form?
No, she did not. She didn't. She didn't even want to switch me to Suboxone, to be honest. I asked her about that. There was no treatment, recovery, 12-step. There was nothing, no other options. It was like, this is what you need to do, or I'm not going to be your doctor.
Okay, so I wanted to bring you on here because we want to talk about awareness for recovery and awareness for celebrating possibilities of recovery, and how did you end up, on here talking about recovery now? I know there's a long story in there, and I'm sorry that we can't give you the time needed to actually share the story, but I really wanted to touch on how you got to here. So what did you do?
Okay, so I mean, I knew about treatment. I knew that for me, if I was gonna become abstinent, that treatment was gonna be something that I would need to do. So I had a friend that was in this community who had already gone through a facility, and then I had my mom, I had my family's super supportive. I had a whole lot of people who were in my corner, who were not giving up on me, who just kept saying things like, we won't do anything to support you in your addiction, but we'll do whatever to support you in your recovery. My parents had really good boundaries, and they just never, ever gave up on me. And eventually I just kind of made the decision like that I would give it a go. Like kind of what else do I have to lose? I guess I'll give it one last shot. And I mean, yeah, so yeah, it's from the people that I had in my life, the people that cared about me. And I also just want to add that I do not believe that I would be where I am today, or I probably wouldn't even be alive. I definitely wouldn't be clean if my parents didn't pay for treatment. Like I was the type of addict, like many other addicts, where being on a wait list, waiting for treatment, going to outpatient clinic to have a referral package filled out, doing those types of things just were not feasible. Like I could barely even make the one phone call to do the intake assessment on the phone to get into treatment. Like it's like a difficult thing to do as somebody who's super entrenched in addiction. And it's just really sad that like I had the opportunity, because I have a supportive family and loved ones and people in my corner that are willing to help me and do whatever to get me into treatment. But there's so many people that just don't have that same opportunity.
One of the reasons why it's important to talk about our stories is because there's so many stories, and your story, you had to pay for treatment to get out of that, to find your recovery. And that's why it's important to talk about our recovery stories, is so we open up the conversations. And like Dr. Wood said earlier, we're progressing and we're making progress, but there still needs more to be done. And ever since I heard your story the first time, it's one of those conversations that needs to be told, because that's why it's important to tell our stories. That's why it's important to go to Recovery Day, so people know. And the story, there's so many different stories, but you know, the idea that you had to have people help you, you know, it would have been nice if people and the healthcare system would have helped you at the same time to get to where you're at today. And so it's not all, you know, wonderful stories. And I appreciate your courage for being here and sharing your story. We've got Carson and Jessica here who are going to also ask some of the panelists some questions. And I'm going to, oh, there's Carson. Hi, Carson and Jessica.
Hey.
Who would like to go first?
Jess, go for it.
Oh, thank you for that. I guess listening to Jordan's experience with the healthcare system, being an expectant mother, and being aware of what the BC Center for Substance Use has done and implemented, I'm curious to hear from Dr. Wood about the Fellows Program that you have rolled out as far as helping better educate the healthcare professionals that have access to us sometimes at our most challenging times. Can you tell me a little bit about that program?
Yeah, sure. This is one of the areas that if you look at sort of in the academic literature where people are asking that question, you know, why don't we have a system? What are the issues as to why this has been such an area where individuals with addiction or family members trying to support a loved one, you know, will run into those circumstances, some of which have been described. And people have continuously come back to the fact that there hasn't been standardized training for healthcare practitioners in addiction medicine. And that's not because there isn't, you know, evidence for what we should be doing. It's just there hasn't been dedicated training programs in this area. And that's been such a huge structural obstacle that contributes. And I often use as an example, you know, heart disease, and that if somebody, you know, clutched at their chest and was having a heart attack and was taken to an emergency department, there'd be trained healthcare practitioners, there'd be standards and guidelines, and then it wouldn't just be that acute intervention. There would be a whole model to cardiac rehab and recovery, and a whole process that people would be on with a view that this is where we want to be in 6 weeks, this is where we want to be in a year, and this is where we want to be in 5 years. And if there's some new discovery in the world of cardiac medicine, there's a whole team of cardiac nurses and doctors and other providers that are going to those international conferences and learning about those things and wanting to bring those innovations home. So we've really agreed with that being a huge structural reason for the traditional lack of a system in BC, and made major investments in training healthcare practitioners. Our program continues to evolve, and I think if we're self-reflective of what the training that the nurses and social workers and physicians in our training program get, and now there's a pharmacy stream as well, is they see a lot of acute addiction issues, often in hospitals or other environments where people are coming in looking for help, but in very active addiction. And as that program continues to evolve, and as the recovery movement itself continues to grow and strengthen, I think there is a whole area in healthcare around recovery medicine and circumstances where an individual may be booked for surgery, and then there's a risk of them getting opioid medication and how that can be managed, or an individual being able to go back to their physician and say, you know, I'm having these dreams of using opioids again. I've been under stress. I'm feeling, you know, concerns, and having a health system response there, in addition to the peer support and other things that hopefully people have. So our fellowship is really looking to fill those gaps, and that has come a long way, though, as I alluded to, there's more to do.
Thank you, Dr. Wood. Carson?
Yeah, hopefully I have 2 questions, Giuseppe, so hopefully I get time, but well, I'll start with the first one. I'll start with a statement though, and that's, Jordan, thank you so much for sharing your story. That's, I mean, we need more of that. It's very courageous. Jeff, thank you for your time and all you're doing. Lorinda and Giuseppe, this one is for you guys, and I can't think of 2 people when you think about awareness and celebration for recovery that have done more for recovery. So, and not just in this province, but across the country. So, hats off to you guys. Here's the question I have: the term recovery itself is being debated in various circles and to various lengths. And it's an anecdote of sort of a bigger picture challenge I think we have, that we focus a lot more on the means than the end. And in that process, I think we lose sight of what the end is. What is recovery?
You know,
Go first, but learn, I'm at you next.
Jessica has got a great conversation when it comes to that, especially in regards to Recovery Capital. And I've done lots of talking in the last half hour, so I think I want to give that to Jessica and Lorinda.
Well played, Giuseppe.
Well played, eh?
I look at
I'll circle back to you.
Yeah, so when I look at recovery, I look at things like, for instance, when the New West Police Department contacted me about my brother's overdose death, they knew how to approach me. They knew what to say. They came in a pair. They were very compassionate and with me and with my family, and I really appreciate that. So when I look at recovery, the fact that the New West Police Department is aware of how to handle those kind of conversations is evidence that they are aware of the recovery process in New Westminster. I also look at things like, despite Jordan's trials and tribulations in finding her pathway to and of recovery, she, as her role in Westminster Health, she continues to change the landscape for mothers seeking recovery, that she is a strong advocate for people's right to access medication to support the recovery journey, that she challenges people's stigmatizing language on the regular. So, by no means am I saying that you need to be a poster child of recovery, but you definitely quietly and consistently advocate for mothers and their needs in this community. And with Lorinda, I know that you have your life full doing your daytime job, yet you put aside that and you practice stewardship and citizenship and you rally. And I know that from what I've witnessed, there's been a lot of struggles getting people together and on the same page and finding that common ground about recovery. But recovery really is about healing and hope at the beginning. Treatment is just an initiation, and despite, Giuseppe and I have differing definitions of recovery, I'm sure everyone on this call and
everyone will
definitely does, but the bottom line is that there needs to be hope attached to recovery, and that we need to continue to find pathways to and out of recovery for that individual.
Thank you, Jessica. Yeah. We have like 45 seconds left before we go to Q&A. Carson, is your second question?
It's a risky one for 45 seconds. It's for my friend Evan, if he's still on the line.
Okay, let's do it.
Evan, you're there?
Yep.
Perfect. Hey, I have a question. So just to build on that, the discussion around the fellowship, one of the things we know about addiction medicine, just like psychiatry, is it plays itself out in GP offices without necessarily even knowing it. When we think about the recovery orientation for that that process for training and educating existing and up and coming physicians, what are some of the more important aspects you feel would be key to impart on our network of healthcare providers?
Yeah, I think it's been really useful to be able to have the trainees go out to places like Cedars and see firsthand what a treatment program looks like. Some of the other things that we've done is, having the trainees go and spend time with people that are in long-term recovery, go to groups, and essentially there's a whole world out there that's outside the medical system, as it should be. And if you're only focused on what's happening within clinics and hospitals, then you're actually looking at the process through a pinhole. So, do doctors need to be out in those other environments? Probably not, but they need to at least be aware and understand them and know about those resources. I'm thinking of Jordan's story and how, we still have so much work to do, and that lots of times physicians only know about things like methadone, and they don't know, well, are you aware of these resources in your community? And obviously, ideally, having those things working in concert. So I think that's what we're striving for.
Thank you, Evan.
Thank you.
And let's work towards that for sure all together. Amanda, are you there?
Yeah.
Hi, Amanda.
Hello, we've got a few questions in the chat here, so hopefully we can take a couple. But Carson, I'm hoping we can start with you with this one. So there's a question in here that says, how can we celebrate the role of OAT in recovery? Sometimes these medications are stigmatized within recovery communities, and there can be shame attached to it. So how can we shift this perspective so that all people feel included?
Yeah, I mean, I guess from my perspective, I think I've seen a lot of change in terms of adoption and acceptance of these components as tools, and in fact, I'd almost say to a point of risk. One of the things I think that is really critical to remember is that there's a plethora of literature on recovery, and much like when you ask the definition of recovery itself, there's some varying pathways and understandings of what it really galvanizes towards. And for me, that means that there's a lot of elements that go into an individual journey. OATs are an important component for some people, absolutely, and certainly in times like we're in now with an overdose crisis, I think that's self-evident, but it's not the only pathway. And if you look at, Evan referenced tobacco, if you look at the literature on nicotine replacement therapy, retention rates, efficacy, it was a tool, but it's not the only thing that helped us move the distance on tobacco challenges in the country. I think there's a social acceptance that's been growing within the recovery community about individuals on OATs, be it Suboxone, methadone, K, whatever the OAT is. It's no different than someone taking medication for diabetes, but you wouldn't continue taking that medication if the diabetes was not severe or was put into remission. So I think it's we can celebrate it to the way we have and keep that momentum, but the risk of over celebrating it leads us to an emotional attachment that necessarily isn't always based in evidence.
Great, thank you. A question for Evan. So Evan, there's comments with regards to the topic, the theme being put forward today about awareness and celebration. So do you have any strategies or tips on how to engage policymakers in events like this, such as perhaps Recovery Day?
I think probably Giuseppe would be better positioned to answer that, because I think he's been quite successful. But I think it's an ongoing education process, for policymakers to understand that a recovery-oriented system of care is a continuum, and that there's no threat to harm reduction and some of the goals that people like myself share, that drugs should be regulated and controlled, but along a continuum that supports people to wellness. And in my clinical practice, I see just a sort of selected group, but most people that I see when I'm providing addiction care want recovery, and the services and supports need to be built out to support that. And I think getting more policymakers understanding the science of recovery and the societal and bottom line benefits for the public purse are critical, and that's work ahead to get them further motivated in this area. I think it's been difficult in the overdose crisis when there's been so much emphasis on preventing people from dying, and that's rightly placed because that's our #1 goal. But hopefully, as we're now several years into responding to the overdose crisis and more focused energy around building an addiction system, that people will come, including policymakers, as the question you posed, to understand how much attention that augmenting and building a really effective recovery system really needs.
Yeah, we're definitely all, as the famous quote goes, we're all fighting for space, and we raise our voices and tell our stories, because a lot of times people just aren't aware that there's a need to raise our voice for recovery. And the conversations across the country for Recovery Month, BC has been a leader in raising the voice for recovery. And it's not just me or not just Lorinda, there's hundreds of volunteers over the years. And Halifax last year had their very first recovery day based on what's happening out in BC and the relationships. Winnipeg's recovery days grown. And sadly, we were all in Ottawa on March 13th, the day before the world changed with COVID, and we were meeting with Health Canada, 7 recovery day chair people from across the country, and we were told by Health Canada that and it wasn't that they were adversarial, they just didn't know what they said. They said the mandate of Health Canada is harm reduction, not recovery, and if you want to change that, you need to get parliamentary support. And the 7 of us almost, well, I cried a bit, and we left the meeting. And it's not that, it's like they didn't realize what they said, but that's what they said. And so that's why, we're still loud. And some people are like, why are you doing this? It's like, because, that's what Health Canada told us on March 13th. And so we have a strategy to try to get Health Canada to understand, recovery needs to be on every page of every policy that comes with drug issues in Canada.
And part of celebration and awareness is to get invited, to have seats at the table, to have a shared unified voice with key points about recovery. There's a lot of strategies to strengthen recovery document that we've all collectively contributed to over the years. So to get policymakers invested in awareness about recovery or attending our events is really to show up and have a seat at the table and actively participate, because it's not harm reduction or recovery. We're all, we all need to stand together when we're trying to help other people find their way, whatever that looks like. In order to do that, we stomp our feet a little bit, but we also show up and share our heartfelt experience and actively participate in our communities on a daily basis. And that's what gets noticed.
Any other questions?
Yeah, we'll take one more here. Jessica, maybe another one for you. How can we ensure that British Columbians are receiving consistent information about the recovery community and options available? Do you have any strategies or tips on how we go about doing that?
Well, I know that with the creation of the Ministry of Mental Health and Addictions, there's definitely a link there of where to get help. As far as consistent information, word of mouth and referrals person to person definitely continues to trump a system of communication. So part of that is each health authority has mental health and substance use services that have, an algorithm of how to get through those systems. But generally speaking, most funded programs and most frontline workers are very aware of what resources are available, as are the police departments, the court systems, all of those people. So as far as the public, I'm optimistic that there is going to be, an ask once and get the help you need, that we're moving consistently in that direction. But I spoke to a mother yesterday where she's like, there's beds available. It's an access issue. It's not a bed availability issue. So, again, we need to do better for people in British Columbia, and we continue to try to do so.
Thank you. All right, we're gonna keep it there with the questions. So if you have any further questions or we didn't get to yours, we will be collecting these and creating a document as Giuseppe mentioned. So please do go ahead and list that in the chat. Before I close off this seminar today, just wanted to open it up to our panelists. Did you have any final remarks you wanted to let our audience know about? Anything you'd like to say?
How about we start with Carson? Do you have any final notes?
Yeah, I would say, I mean, it's a great topic, and I think the important thing to remember when we talk about stigma and you know, naturally, I think denial goes to stigma, and the reality of recovery is possible, and it's not hearsay, it's not anecdotal, it is by definition and evidence-based. There's people of Recovery Day that fill the streets. There's academic literature. There's lived experiences of, you know, people that have taken all kinds of pathways. And I like what Jessica said. I mean, harm reduction recovery. However someone gets to you know, a place where, you know, they're actualize that quality of life is sort of irrelevant. You know, the worry I have is you know, a system that perpetuates, you know, unnecessary applications of treatment over time, and that you know, and not what that would do to suppress, you know, the things we experience in recovery. So I think it's possible, it's attainable, and with the right pathway and the right commitment to it, it should be expected.
Jordan, I have one question for you. Have a minute to answer. What do you think expecting mothers need to hear from the healthcare professionals, for the moms out there?
I just think it's really important that they know that there are options. Like, it's kind of already been talked about a little bit in the past hour here, but it's just, yeah, that there are options. And because I know that methadone and other OATs are super helpful for some people. I just know that for me, looking at a 20-year-long thing wasn't something that I wanted to be. I didn't want my life to be like that. And it's just, I think that everybody needs to know that there are other options. Yeah.
Excellent. And we still got like 2 minutes left. So Lorinda and Sergeant Scott. Lorinda, do you have any final notes that you want to add about Recovery Day? You're on mute again.
I think that we're all looking for the silver lining in the COVID world that we're living in, and the silver lining for Recovery Day this year is that by going virtual, we will be able to have the whole country together, united as one.
Excellent. Thank you so much. And Sergeant Scott, literally like 40 seconds left. Sorry about that. Any final notes for the police department and what's happening?
Yeah, we want to celebrate with you. We understand stigma in our own way. You know, there's stigma in policing with our own mental health, with our own PTSD, and what's been refreshing for us from the top down and all throughout is that it's okay to talk about. So we want to celebrate internally with our own members, but we want to celebrate with the community in what the community is going through, what are people recovering, and that helps tear down any barriers between us and them, and that helps recognize that we're in this together. So we want to celebrate with you. Don't be afraid to come up and talk to the cops at Recovery Day Fest or just on the street. Interrupt our coffee at Starbucks and talk to us. We absolutely want to hear it, and that helps us get better as well and understand more. So that's kind of my last thought on that.
Thank you so much.
Thank you.
All right, so I'm just gonna share our resources here at the end. So we're gonna leave it there. But we wanted to mention that we do have this list of resources. So what's going to happen is we're going to post this recording. If you want to come back to it or share with a colleague, we're going to post these slides. You can access all of these resources and all these documents. But I do hope that you'll join us for the rest of this series. So we still have part 3 and part 4 happening next Wednesday and the Wednesday following. So a huge thank you to our panelists and Giuseppe, our co-moderator today. I thought this was a great discussion and really looking forward to the rest of this series, and thank you for attending on this Wednesday afternoon.
Thank you, everyone.
Thank you.
Thank you. Bye-bye.
Thanks, everyone.